Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Waris. Welcome you are in Healthcare with Dr. Waris. Viewers, today's topic which I have chosen for you is breast cancer. First of all, before going to breast cancer, I hereby clear you that what is cancer. Cancer is actually uncontrolled and undefined growth of abnormal cells in the body. That's called cancer. I had described the prevalence of this disease that worldwide 1 million cases are reported every year, and only single in Pakistan we have 90,000 cases per year, and out of them 40,000 dies. 1 out of 9 is suffer from this disease. Young females in Pakistan suffers more. And in Karachi, there is a high prevalence rate in Pakistan. Whereas today I will describe for you breast cancer. Breast cancer is of mainly two types. And ductal carcinoma, which is 80%, and lobular carcinoma 20%. And other type also, which we call non-invasive carcinoma in situ, in which it is represented like pudgy orange like skin is appeared on the nipple, and indrying of nipple is also seen there. First coming on the clinical presentation of this disease, one feels palpable mass with nipple discharge in about 10%, pain in 7%, and 40% have axillary involvement of lymph nodes, and pudgy like orange skin is there also. When nipple retraction will be seen in this condition, and nipple discharge of blood or smear comes out of these nipples. Coming on the investigations and confirmation of this disease, we have to do mammography, ultrasound, free fine needle aspiration for cytology, and biopsy for histopathology. But any clinically proven by mass field in this breast can be biopsied, and then we will come on the diagnosis and confirmation of cancer. Histologically, we see estrogen and progesterone status and HER2 status of this breast condition. HER2 is the human epidermal growth factor receptor, and these receptors promotes the growth of cancer cells, and once it is diagnosed, it might be metastasized in other organs of the body. Commonly it spreads to the bone at about 70%, lungs 60%, in liver 55%, adrenals 35%, and in skin 35%, and brain 20%. And coming on the risk factors and predisposing factors, it includes mutation of the cells, and due to early menarche, late menopause, first pregnancy more than 30 years of age, incomplete pregnancies means abortions and miscarriages, overweight, over BMI means body mass index, and not awareness of the personal hygiene, and not access of our Pakistani women for proper checkup, and lack of screening centers, and lack of breast self-examination techniques given by the local healthcare providers to the community. It is more common in left breast. 1% of all breast cancer also occur in men. Synchronous cancers, when cancer recurs within the 6 months of the primary cancer, and it's also most common in developed countries which have few children and less frequent breastfeeding, and it also seen in the tall woman, which is 5.8 inch height, So these are some predisposing factors. And now coming on the treatment. Treatment, we have the lumpectomy plus radiation, which is also equal to the mastectomy, and purely mastectomy. And mastectomy history is also 1500 years back. So it is a very authentic treatment for that breast spreading and non-spreading breast cancers. Endocrine therapy, tamoxifen and relaxofen also used. Some interesting facts about breast cancer is that it is a lifelong. Nuns who have no children are prone to cancer. It's also called nun's disease. And wasp dung is mixed with the cow's brain and applied to the breast tumor for 4 days, results good. And those workers which work in night shifts more than 30 years are more probable and more prone to develop the breast cancer. American Cancer Society recommends annually mammography from the age of the 40 years. Mammography is a kind of X-ray of the breast in which we can see the early growth of the tumor. Viewers, it is all about our breast cancer. If you have any query or question, you may write in comment box. Till then, Allah Hafiz.